So Dr. Ann Lee is here with us. Title of her talk is Rethinking Cancer Treatment Using a Functional Medicine Approach. Despite significant advances in our understanding of cancer over the last decade, treatment options have remained relatively unchanged. A growing elderly population and modern environmental exposures may present new challenges to fighting cancer. In this presentation, Dr. Lee will discuss the root cause strategies and the potential targets which are not traditionally addressed in the management of malignant diseases. Dr. Lee attended medical school at the University of Texas Health Science Center in San Antonio, completed residency in Physical Medicine and Rehabilitation at Loma University Medical Center in Southern California, where she did research and published papers in traumatic brain injury. Afterward, she accepted an academic position with Stanford Medical Center and was attending of the Polytrauma traumatic brain injury unit at VA Palo Alto healthcare system, where she cared for combat soldiers who suffered from blast injuries due to improvised explosive devices. Over the years, her practice focus has expanded from neurotrauma to include treatment of neuromuscular pain and chronic inflammatory disorders. Please welcome Dr. Lee.
Thank you so much. Can you hear me okay? Excellent. Thank you so much for staying. It's getting late, isn't it? So I do have some disclosures. I am a distributor for CIA Inc., which is one of the supplements I'll be talking about. I also have another disclosure. I am a Sunday school teacher, so every week I'm actually speaking to young kids who are barely breaking out in pimples, so this is a different audience for me. But you know what I try to do is try to make a complex idea very understandable. So hopefully these slides will, you will understand that, the audience I usually talk to when you see these slides. Okay, so when it comes to cancer, this is a slide actually that I copied from the American Cancer Society. This question is usually asked. Why did this happen to me? Why am I sick? I've been healthy all my life. Why am I the person with cancer? The real question I think we should ask is, why did this not happen to me before? Because when we actually look at the environment in which we're living, when we see all the air pollution around us, the water quality that's getting poorer and poorer, the livestock that's being grown in basically barren fields, when we see how our food is being manipulated genetically, how we're spraying herbicide, pesticide on all of our food, it's a wonder we're still breathing. So this is really the question. And the reason why I want to approach it in this way is because there is a reason why we're still alive. There's a reason why we're still healthy, that we can be healthy even in this environment. So functional medicine, what we try to do is we want to address root causes. And so you see this illustration of a tree. There's root cause on the bottom, and then it manifests as a health status, your health status as the fruit. So if your fruit is cancer, what is the root of this problem? In general, I think the argument now is there's a genetic component or there's an epigenetic component, often referred to as the metabolic component of the origin of cancer. Okay, so what is it? Is it the genetic component that makes us predisposed to cancer, or is it the epigenetic, the metabolic component? Where's the chicken, where's the egg? Maybe it's both. And there probably is a component of both. Or maybe it's neither. It came from nowhere. That's really physical. But whether it's genetic or epigenetic, the point is that the cause of the cancer to grow it basically boils down to an impaired immune system. Okay. But I actually don't like the word impaired because it's not really impaired. Something's working, right? Something's working to make that cancer grow. We have to understand it's also not really dysregulated because the formation of cancer, all the metabolic processes that are involved in cancer growth, it's highly regulated. So it's not even really abnormal. The reason why we want to say it's not really abnormal is because so many different types of cancers have very similar patterns. So what is a good description of what is happening to our immune system when we have cancer? I kind of have a good word. My choice word is, it's toxic. The immune system becomes toxic. So when we try to imagine what a toxic immune system looks like, I hope this slide isn't too extreme for some of you. We kind of want to think about a terrorist. Okay. If you think of cancer as being like a terrorist organization, this will make it very easy for you to remember what it does and how it grows. Okay. First, it disguises itself. It grows on stealth mode. It recruits our members to their team. Then it sends out like spies to send false messages to mislead us, the host. Then it starts to instigate a war. And then it sacrifices itself to build the team. So let's go into each point in detail. It disguises itself. How does it do this? So one of the things that tumor cells do when it changes in order to try to adapt to the environment so they can survive, because our environment in general, we don't want it there, so our immune system wants to kill it, but it doesn't want to die, right? So they have to make some chemical changes, some genetic changes within itself to adapt to that environment so they can continue to live. One of the ways they do this is by downregulation of what's called an MHC1 molecule. This is a major histocompatibility 1 molecule. This is what is an MHC1. I think most of you guys may know this, but what it is it's kind of like your red flag. Every cell in your body has this. It's your red flag. It tells the environment, hey, look at me, I'm sick, please kill me, okay? Because I don't want to make the host sick anymore, okay? But it downregulates that because tumor cells don't want to die. They want to survive. Recently, there was research done at Stanford that found out that they also make what's called CD47 proteins. And these particular proteins are upregulated. So what are these particular proteins? It's basically the protein that says, don't eat me, I'm a friendly. Okay? It's deceiving the host, saying that there's nothing wrong with me, leave me alone. So the cytotoxic T cells will say, okay, I'll leave you alone. I'll just go to that one. Okay. Next, it grows on stealth mode. So it continues to grow. Most of us, hopefully not many of you because you live healthy lives, but cancer doesn't show up tomorrow, doesn't show up next year, does not show up for 2-3 years. It may take 5-6 years, may take 10 years for it to grow with no symptoms. So there's this thing that's called volume doubling time. And on average, it will take 30 volume doubling times in order for an average cancer cell to show up on an imaging study of about 1 centimeter squared, right? And that would be about 6 years. So for 6 years, you would have no symptoms. And then you would have a scan that actually shows a very small mass. So if you're really thinking about, quote unquote, early detection, it's not quite early, is it? Because you're still many years into your cancer. So early detection is actually somewhat of a misnomer. Number 3, it recruits our members to their team. How do they do this? So they start secreting what's called cytokines. Okay? It starts with HIF1 and SDF1, but basically it recruits our normally friendly immune cells, the immune cells that try to help us control autoimmunity. It recruits those cells to be on their team. Basically, these are tumor-activated macrophages and Tregs. There are also cells called myeloid-derived stromal cells and intratumoral DCs or dendritic cells. So these are normally, our cells are supposed to be on our side. They're supposed to be protecting us from autoimmunity, but instead they're protecting us from protecting the tumors from us being able to get to them. Because now these tumor cells are being recognized as normal cells. Okay. Fourth, it sends spies with false messages to mislead us. So when I say this, is basically, I'm wanting to talk about how cells communicate. Cells communicate by sending out cytokines, specific types of cytokines. And the cytokines that are being promoted by tumor cells, these are not cytokines that we really want in a normal situation. Okay. TGF-beta is an inflammatory cytokine, causes some chronic inflammation. IL-10 is an immune suppressor. Okay. Also, there are other cytokines. Arginase nitric oxide causes more immune suppression. ROS is reactive oxygen species. There are reactive nitrogen species, all types of things that causes basically a really toxic, acidic environment around the tumor cell, or the tumor mass at this point. Then when it's ready, it starts to instigate war. That means it's ready to invade. Okay. So one of the things that it can do, it can express PD-1 proteins. And basically, this is a protein, a transmembrane protein, that can literally kill a cytotoxic cell. So one of our friendlies, one of our lymphocytes that actually want to kill that tumor cell, well, that tumor cell kills it first. Okay. Another thing is that it wants to invade into our vascular system because now it wants to find another home. Okay. So it can express what's called selectins, integrins, specific integrins are called ICAM, VCAM. And these allow for the tumor cells to go into the vasculature, to travel, and then transform back into a tumor in another organ. It also sacrifices itself to build the team. So tumor cells are because they're very highly metabolic, they're growing very quickly. And eventually the vasculature can't get to the middle of the cell or the mass. And the interior of that tumor mass becomes necrotic. Well, that necrotic tissue actually provides fatty acids, glucose, lots of nutrients, everything that the live tumor cells would need and can use to continue to grow. Okay, maybe you can't read this. Okay. So cancer cells require a certain environment for this to happen. What is that environment? That environment is called hypoxia. So everybody, let's take a deep breath. Okay. You just helped your environment from expressing what's called HIF1, the hypoxia-inducible factor 1. This is what causes your cells to switch from an aerobic respiration pattern to an anaerobic respiration pattern. This is why so many things about oxygen is important when it comes to cancer prevention. Okay, so this is just a summary slide that's a little bit more technical. So we're seeing here, I'm not sure if I have the time to go through all this, but this is just a summary slide of everything we basically talked about. Okay, and here is the actual cancer cell. Yeah, not a pretty sight. So hopefully I've scared you enough. Now we're going to do something about it. Let's do something about it. Okay. So we want to boost our immune system. What are we going to do? So if you were to come to our office, this is what I need to know about you to help you take care of your health. So we take a history, we look over your diet, take an assessment of your sleeping pattern, your stress patterns. Do you exercise? How's your energy level? I'm going to touch on the ACE score a little bit further later. It's called the Adverse Childhood Events Score. And all of your exposures. And how's your teeth? Most people kind of, even when I was in medical school, we didn't think much about teeth, but we're now finding that it's almost central. It's central to your health. your birth history. Were you a C-section child, or were you a vaginal birth child? Were you breastfed? Extremely important questions to know. Head injuries. So now we're finding more and more about the connection between the brain, the central nervous system, and the microbiome. So if you've had a head injury, there is a risk of you compromising one of your most effective fighting tools, which is your microbiome. Your past medical history, your family history, this is where we want to know a little bit about your genetics, your social history, what are your exposures in terms of, do you drink a lot, do you smoke, do you use your cell phone all the time, is your Wi-Fi on all night? Okay. Medications, allergies, your supplements, and then we do an exam and we look at some specific labs. So one of the first things I'd like to do is, you remember that tree we were talking about? One root cause could be genetic, a root cause could also be epigenetic or metabolic. Well, we like to look at both. So we're taking some genetic testing. And we don't do the genetic test as like a conventional genetic test. We don't look for, BRCA genes or anything like that. What we want to look for when we do genetic testing is, do you detoxify well? How's your liver working? How's your kidneys working? Are you able to metabolize your vitamin D? Are you able to metabolize vitamin A? So these are the things that are really important for us to know, because we need to know whether you can actually utilize the nutrients that you're consuming, and also if you're able to rid your body of the toxins that you're exposed to. Another genetic test we do is called an HLA-DR panel. This is more commonly known as the Shoemaker panel. We want to know the genetic susceptibilities you have, your immune system has. So Dr. Richie Shoemaker, who is a prominent physician and very well known, you probably all know him, in mold toxicity and mold illness. He did a lot of research and found these patterns. And so we want to know if our patient population has a certain pattern that would make their immune system susceptible to their environment. What's really interesting is the studies are actually showing that 24% of the population has a mold sensitivity. 24, that's like almost a quarter of the world population. Yet at our clinic, when we do this test, we're talking about 90+% of our patients have something positive on this panel. Okay, we do what's called an immune frame. This is a lab in Greece that does this for us, because we want to know and survey the status of your immune system. We want to know if you have antigen-presenting cells, if you have a high level of certain cytokines. So these that I've circled here are kind of the main focus of what we look for when we do the study. So this particular patient, it has a down-regulated immune system pattern. Okay, so when we say it's down-regulated, and this is a patient who has cancer. Okay, she has metastatic breast cancer, but she doesn't have any antigen-presenting cells at the bottom there. Oh, is that out of focus? So the antigen-presenting cells are really required for her to be able to stimulate her immune system, and yet she has none. Okay. Rather, unfortunately, she has an elevated level of TNF-alpha, the tumor necrosis factor alpha, which would suppress her immune system. And she has some interferon gamma, which would help boost her immune system, but it's quite low. So right now, what she's experiencing is some chronic inflammation. This is not going to be helping her at all. She's not fighting off her cancer well, as opposed to this patient who has an upregulated immune system. So here we're seeing a high level of antigen-presenting cells. You can see that at the bottom there. We're seeing that her TNF-alpha, this patient actually has lung cancer. TNF-alpha level is low. It's actually in the negative. Okay, so we know that she doesn't have much immune suppression going on here. And she has a very robust Th1 response with a high interferon gamma level. Okay, so this is what we want to see grow or develop in our cancer population. How do we monitor whether a patient has cancer, whether our treatments are being successful or not? This is not used, obviously, in conventional medicine yet. Hopefully, it'll be used sometime in the future. But this is an assessment of circulating tumor cells that are in your blood. This particular patient had 5.4 cells. So it's problematic, frankly, to even have one. So at 5.4, we know that she's got some issues. We have to basically help her get this number down. Okay. Some of this, is this pointer working? So these actually are what's called markers that describe the activity of the cancer cells. Some of these markers are more problematic than other markers because they are surface markers for cancer stem cells. And when you have cancer stem cells, you know that those are going to be more resilient, more resistant to chemo, more resistant to treatments, and they're the ones that are going to, get in your bloodstream and present somewhere else in your body. We also do hormone testing. This particular patient had a very dysregulated cortisol level, just shot up right there when it's supposed to be really low at night. Okay? So your cortisol level, the reason why we want to know this is because stress has so much to do with how well you are regulating your other hormones. Okay? Cortisol is actually important for us to get under control because it can lead to insulin resistance. And one of the metabolic components of cancer is insulin resistance. We also do a stool test. Here we can see, what their microbiome is looking like. Now there's plenty of research coming out of Stanford by Erica and Justin Sonnenberg, whose talk I just recently listened to. They're doing awesome research. We don't really have a good idea of what the ideal microbiome is for Westerners, but we know that we don't have it yet, that's for sure. And this is some of our standard lab work that we do at Anatora. So what are we going to do to support your immune system? Basically, good stuff in, bad stuff out. That's what we want to do. It may sound really simple. This is actually what keeps you healthy. This is what keeps you alive for a long time. It may sound really elementary, but this is exactly what we need to do. Just good stuff in, bad stuff out. The complications come in where we have to question what's the good stuff and what's the bad stuff. When I say what's the bad stuff, we have to find out, do you have heavy metals? Do you have mold? Do you have other chemicals in your body? What are the bad stuff that are in your body? Do you have mercury in your teeth? So these are the things we want to do to help your immune system. We want to optimize your microbiome. That's number one. We understand that the microbiome is extremely important in supporting a very healthy immune system. The next thing we want to do, one of the next things we want to do is detoxify your system, your body, of whatever is keeping you from being healthy, whatever is keeping your immune system from functioning optimally, we want to get it out. That's what we're talking about with the metals and the chronic infections. So let me just comment just briefly on that. Most of us, if we have compromised immune systems, we're going to have viruses. Those viruses will compromise our immune system even more. If we have parasites, same thing. I'm not surprised. There was a person who was talking about parasites being a cure for cancer. This may be one of the mechanisms by which it does this, because if we are able to get rid of the parasites so that our immune system can be stimulated again, of course that's going to help us fight cancer better. Dental health, we see, whether you have toxins in your mouth, this quote-unquote silver fillings that are actually mercury fillings, and we need to get that out. We have to assess your sleep pattern. This is so important. One of the things we're neglecting, actually, as a modern society is our circadian rhythm. We're not understanding anymore that we actually do need to sleep at a certain time because our lifestyle has become so adjusted, I guess, to our current requirements, I guess, from society. We're supposed to be waking up at a certain time. We have to live indoors. I actually describe it this way to some patients. A long time ago, when we were actually agrarian, or even before that time when we were hunter and gatherers, this is for tens of thousands of years, our brain has evolved to be in a certain type of environment. Basically, we were living in caves. We got up with the sun. We slept with the sun. When it was during the day, we were out in the sun and we were foraging for our food, so we were very active. That's what our brain is used to. Our brain is used to getting up with the sun, sleeping with the sun, and not having any light exposure during the night. But what do we do now? What time is it? Okay. So we get up in our indoor house, we go into our indoor car, we go to our indoor office, okay, where we spend all day, and then we go back into our indoor car, we go back into our indoor house, and then what do we do when it's at night, 6 p.m., 7 p.m.? We turn on the lights, we watch TV, we finish up our work, and we're up until 10, 11 p.m. in the morning, being exposed to blue light when we're not supposed to. This is not good for your brain. It's toxic for your brain. This is completely against what your brain is used to in setting a circadian rhythm. So we talk to them very seriously about this. Another, of course, is stress. Another serious thing is stress. We just mentioned the cortisol thing. Because I don't have a lot of time, just let me quickly talk about the supplementation and specific cancer treatments. Because stress is actually something I'm going to mention again later on in a different slide. Okay, so here is a picture, a beautiful picture of our microbiome. This was taken by the Sonnenbergs in Stanford. Love them. So we have trillions of microbes in our gut. And they help us make neurotransmitters. They support our immune system. They help us maintain a good gut lining in order to prevent autoimmunity, so no weird things get through.
This clock's 10 minutes faster.
Oh, okay. All right. Okay. It helps us to even fight off different toxins by detoxifying things for us. It helps us also balance our gut microbes by killing off bad microbes. So we have to have a good microbiome in order to maintain this type of function. So how do we maintain a good microbiome? Well, let's talk a little bit more about the microbiome. This slide actually I just found because it has a good summary of some of the things the microbiome does for us with metabolism, helps us control obesity, control inflammation. It actually helps us maintain a good neurotransmitter balance so that we have that good brain-gut connection. I want to talk a little bit about this African tribe. They're called the Hadza, Tanzania. This is a slide from one of Dr. Sonnenberg's talks. So they do a lot of research on this tribe. This tribe's current lifestyle and diet is very similar to our lifestyle and diet thousands of years ago when we were hunters and gatherers. So they still basically live the same way that we have evolved over thousands of years. So, they're waking up with the sun, they're sleeping with the sun, and they're eating what's available to them from really organic food, okay? So their lifestyle is basically, when they get up in the morning, the men go out to hunt, the women go out to forage. And when they go forage their food, most of it is very fibrous-rich tubers. Now, some of these tubers are so fibrous-rich that they can't eat it. They chew it and they spit out the fiber. But their fiber intake is so much higher than ours. And when the Sonnenbergs actually studied their stool, their microbiome, they found out that their microbiome is much, much diverse than the average Westerner. Okay, they were wondering, what was causing this richness of the microbiome in this population. And basically, it's fiber, the fiber content of their food. Now, the Hadza also ate meat every once in a while, but this is when they got lucky and they were able to catch a zebra. And during that time, if they had a zebra to eat, 15,000 calories, they could eat it all in one day. Okay. So they're omnivores, but most of their diet was vegetables, basically, starchy vegetables. So over the years, our fiber content with each advancement in food technology has actually decreased more and more. We've been breeding our food to become softer and softer and gentler on our digestive system, unbeknownst to us that it's actually bad for our microbiome. Okay. So in the past, when we were hunter and gatherers, our average intake was about 100 to 150 grams of fiber a day, whereas now the average American is eating about 15 grams of fiber a day, so about 10% of what we have evolutionarily been used to. So here it just gives us an idea of our microbiome diversity. With each advancement in food technology, it's become smaller and smaller and smaller. And there are some reasons why this would happen. Antibiotics, our high, SAD diet, standard American diet. We sanitize everything, killing off the microbiome that we do have. Vaccinations, baby formulas, we talked about C-sections. Okay. There was a study, actually we've known about fiber, the health benefits of fiber, actually for a long time, even before we knew about the microbiome. But we didn't know why fiber was so important. Well, it turns out it's probably because it's feeding our microbiome. It's the food that we cannot digest ourselves, but our microbiome actually absolutely needs to stay healthy. Okay, now let's talk a little bit about detoxification. So your body actually has a natural detoxification system. This is what we need to encourage. When you sweat, you're detoxifying, okay? When you're breathing, you're detoxifying. When you're pooping, you're detoxifying, obviously. Okay? When you're peeing, you're detoxifying. All of these organs need to be supported in order for us to get the toxins out of our system. And what are the toxins? So mold is a big one. Anything we ingest or inhale that's not supposed to be in our body, things that we absorb, your Bed Bath & Beyond lotion with whatever chemicals are in there. Okay. Plastics, all the chemicals in our household cleaning products, even your hand soap could be absorbed in your system, and it doesn't belong there. So I want to talk a little bit about this. I'm not sure, who was here for Lena Poo's talk a couple of months ago? Excellent talk. If you didn't hear it, please look at the YouTube video. So she had a great talk on EMFs. And I wanted to talk a little bit about this more because we're, like Dr. Herskowitz was mentioning, we are actually in the middle of a human experiment when it comes to EMF exposure. We have never had this kind of exposure in our evolutionary history, ever. So the amount of EMF that we're supposed to be exposed to, that we've evolved to be used to in order to thrive in terms of our health, was basically zero. It's just whatever came out of the earth. Okay? But the frequencies that we are experiencing now, being exposed to now, is it 1,000 times worse than in the past 10 years? Is it 100,000 times worse than in the past 10 years? I'm probably not getting the number right. But I think it's like 1 quadrillion times, it's quintillion times. And I don't even know how many zeros that is. Quintillion times worse. That's how much exposure we're getting, and it's not getting any better. In fact, I think I saw an article very recently. We're going to be launching hundreds of satellites into our atmosphere. This is going to happen very soon. I'm not sure if it's already done. Okay. Nice. All right. And we're doing this to our children. So we have to understand that we are not in a place to be complacent. We didn't grow up with this kind of exposure. As we're older, we have more body mass. Most of us in this room, our brains are pretty well developed. It's not still in the developmental phase like fetuses' brains, little babies, infants' brains, toddlers' brains, school children's brains. They're still developing. And one of the most adverse effects of EMFs are on nervous tissue. Yes? Oh, okay. Whoa, a lot of slides to go. And this was actually a study done on military personnel that found these adverse effects. I want to show you a more recent study. This was actually a study done in Europe. Okay, they found there actually was, this is an epidemiological study, our standard study, our standard, of care type of study. This is the kind of study where we would establish a standard of care as an epidemiological study. Okay, completely ignored. So in England, from 1995 to 2015, they found that brain tumors increased from 2.4 to 5%. Not much of an increase, just another 2.5%, right? It's over 100% over this time. How can that be ignored? So they didn't say specifically that this had to do with cell phones or cell towers, but something had a dramatic change. There was some sort of drastic influence that would cause this rise in brain cancer. Okay, next is mycotoxins. This is an article that talks about a type of mycotoxins that can influence cancer. We talked about dental health. I have to fly through these next 10 slides, the next 4 minutes. And it's very important for us to make sure that the dentation doesn't have a chronic infection, because that can lead to chronic inflammation. It can definitely be suppressing our immune system. We talked about sleep. And these are some of the supplements. This is by no means a complete list. Very, very short list, frankly, of what we can do to help boost our antioxidant levels and help boost our immune system. Okay. I wanted to talk a little bit about redox signaling supplements, because we know that one of the ways that cancer thrives is by eating up a lot of sugar. So you don't want to eat a lot of sugar, and you want to eat. I guess I actually have not made my own 100%. I'm going to do this type of opinion about this, but the ketogenic diet has had good studies that show it can be effective, more effective, actually a better type of diet for people who have cancer than other diets. And this particular supplement, redox signaling supplement, this study is showing that it increases your fatty acid metabolism. Okay, so if you provide your cells with fatty acids, which your normal cells can metabolize very efficiently, then you can actually kind of evade the metabolic processes of the cancer cells. Although there are, of course, cancer cells that can also use fatty acids. I want to talk a little bit about ozone. Plenty of studies to show that ozone therapy is very effective in being an adjuvant treatment for cancer therapy. Exercise. Do you really want to see this slide? So exercise is one of those things I really like to talk about, because I mentioned this before in a previous talk that I gave. Exercise is everything that our body needs really to stay healthy. And oftentimes some of the treatments that we give, some of the therapies that are available, even hyperthermia in some ways, that works to treat cancer, we can replicate just by exercising. We improve our circulation. This boosts the immune system. There's better cognitive effects from exercise, better oxygenation. We prevent the hypoxic environment where cancer cells thrive. In other words, please exercise. Other treatments. So there are cancer vaccines that are coming out that are have shown some promise in treatment. P53, as Dr. Herskowitz has mentioned, is also a target for cancer treatment, and unfortunately unavailable in the United States, but has been showing some good promise for treating cancers. Peptides for cancer treatment, there's a specific peptide called PNC27 that has been shown to cause tumor cell lysis, and with very, very few side effects. So these are some treatments that we can use without the toxic effects of chemotherapeutic agents or radiation. Okay, let's talk briefly about insulin potentiation targeting therapy. So this is basically chemo, but at a much lower dose. And we're able to have it be effective by utilizing a strategy of insulin. Okay, so cancer cells express basically 10 times more insulin receptors than our normal cells, and we're going to use that to kill them. So basically, if we put in the insulin along with the chemotherapy, then those cancer cells will just eat up that stuff. And that's how it works. Okay. So lastly, I was telling you I wanted to talk about stress on a different slide, and this is the slide. I'm not sure if you guys are familiar with Dr. Gabor, I think it's Gabor Mate. He wrote a book called When the Body Says No. Okay. And in this talk, actually, I just heard this talk, he was mentioning an Australian study because he believes that many of our chronic illnesses, basically all of our chronic illnesses, including cancer, has a very, very strong emotional origin. So there is this Australian study he was talking about, involved about 500 women. And so they took a little biopsy of breast lumps. And before the biopsy results came back, what they found, they asked these women, there was a stress questionnaire basically. And what they found was for women who were just isolated, there was no real increase in risk. When their biopsies came back, they were doing a comparison. And for women who were just stressed, there was no increase in breast cancer risk. But for women who were both isolated and stressed, their risk of getting a positive biopsy was 9 times higher than those who didn't have that. So how does this make sense? How does 0 plus 0 make 9? Okay. So, this is kind of where we want to understand the effects of stress. Now, stress is actually very beneficial in the short run. In the short term, we need it. It's a survival instinct, right? But once that danger is gone, we need to be appeased. We need to turn off that sympathetic system, and we need to turn on a parasympathetic system. That parasympathetic system is what we need for our blood to flow to our internal organs, so we can digest our food, so we can reproduce, so we can do calculus. Okay. But if that's not there, if we remain stressed, and nobody is there to appease us, that cortisol level continues to remain high. And that would lead to insulin resistance, and that would lead to problems with our metabolism, our cellular metabolism. That would lead to things like cancer. Okay. He quotes here. Oh, okay, we have to stop. All right, so I think that's it for my talk then. Thank you very much.
Sorry, but we ran out of time here. If I can get everybody to raise their hand that they'll clear the room within 5 minutes, I'll give her one question. No, it's 10 minutes.
No, on my watch,
I've got 10 till. We have
46, your watch is fast.
Okay.
So 5 minutes of questions and then...
About 2 minutes of questions is what I got. Yeah, exactly. We got to wrap up the equipment and we got to get everybody out of here. So I think I'd have to, we'll do one question and hopefully Dr. Lee can give us a quick answer.
So my question is, what are your recommendations for diagnostics like detection of cancer, and especially around women and breast cancer?
So RGCC, that's the short answer. So it's a lab in Greece that we use frequently.
And that was on one of the slides. So you can talk to her afterwards as well and kind of clarify a little bit. But let's thank Dr. Lee.